and welcome to another very informative session right here on Afia TV, talking about the Gyna Plus, a program where we talk about health issues that affect women and girls in the society. My name is Doris Mayim-Shishe, and this is a platform, like I said, where we discuss health issues, and this program comes up every Wednesday at 6 p.m. We have our channel on YouTube, Afia Lifestyle and Culture, where we have so many health information that are up already, so you can go there and watch them. And of course, last week we started a conversation on HPV vaccine, why it's important, what it causes, what is it responsible for, what ailment it is responsible for, and why it's crucial for, parents, women, girls to take this vaccine. And I had my guest, Dr. Ikenna Emedike, who gave us some insight because he's a social media and champion on immunization on social media for Enugu State. And then he gave us some holistic view on how to go about these issues and the problem he's been encountering. And I did mention that we'll have more coming up in the second part of this conversation. And here we are. We're going to break. And after this, of course, we'll meet Dr. Ikenna again. Please stay tuned. We'll be right back. Welcome back. You're still on to Gyna Plus right on Afia Television, and this is a health space. Call it a healthy space where we discuss health issues that affect women and girls in the society. And of course, I am Doris Mayim-Shishe. Enough of me. Last week, you met Dr. Ikenna Emedike, and today he's still here on the show. Dr. Ikenna is a social media campaign immunization officer for Enugu State under the umbrella of IPA and PAN. That is International Pediatric Association and the Pediatric Association of Nigeria. And he's been doing quite a lot, preaching about vaccine, HPV specifically. And we started this conversation last week. So Dr. Ikenna, it's good to have you again.
Thank you so much.
Welcome. You're looking really different.
Oh, really?
Will I say younger this time? I think more younger.
Oh, well, perhaps it's just a tight clothes.
Welcome.
Thank you.
Last week we talked about HPV vaccine. We started a conversation on HPV vaccines,
Yes, exactly.
And you talked about quite a number of things. And good enough that last week, we marked the World Immunization Week.
Yes.
And in as much as that's not something that should just be a one-off, awareness thing,
Yeah.
it should be
Repetitive.
yes, it should be a continuous. So
Absolutely.
I'm glad this conversation is coming in really timely.
Absolutely.
So no, we started off. You talked about some of the issues around HPV vaccine. We talked about side effects. briefly.
Yeah.
We mentioned what parents should do briefly.
Exactly.
But I'd like us to dwell more on it in the second part, right?
Okay, no problem.
So we'll just do a rundown, a bit of a recap on what we talked about last week, and then delve into the side effects. So just take us through what we did basically from vaccine, why it's important, what HPV does, and what actually this vaccine prevents. Basically, then we talk about side effect holistically.
Okay, a bird's eye view.
Yes, just
HPV means human papilloma virus. HPV causes cervical cancer, especially strains 16 and 18. And prevention is always cheaper and better than cure. So taking a shot of HPV vaccine definitely prevents all the attending complications of cervical cancer, including death. So I believe that the side effects should actually not make people to fear about the taking or accepting the intake of the vaccine. The side effects are usually mild and disappear within 24 to 48 hours. However, should in case there were severe symptoms, it can be managed. HPV vaccine has never really caused death. There has never been any recorded event of death. For those who are afraid of reduction in population, for those who are afraid of infertility, and for those who are probably thinking that, oh, our daughter is too young to be, having this kind of medicine being given to them about sex. You know how the normal African mentality is, and African parents. So these fears are actually should not be a thing of worry. I understand. We understand their concerns and their fears. But the truth is, we cannot give them what is not safe for them, especially something that has been approved by the National Primary Health Care Development Agency of Nigeria. It is safe for our population.
All right. I mean, thank you for that recap.
Thank you.
Now, the big question, which you mentioned briefly in the previous episode,
Yes.
the side effects.
Yes.
Now, before I even take you to that part, when the HPV vaccine was rolled out in 2023
Yeah.
and expanded towards 2024, and
Yeah.
I think, and there's still plans to actually begin that again. From the information I have. So, I mean, that was for girls 9 to 14. So, but for women older than that, you just put us through that procedure, Gyna, because this information is very important for women who are watching now. And it takes me back to the survey I did recently, how so many elderly women said they've never heard of the word HPV, talk more of HPV vaccine. There's no information of any kind. So how do women like this get access to these vaccines? What should they do basically? What is the beginning phase for them? What should it be like as a starter?
Well, I would want to summarize this from a certain perspective. I feel that this is something that our women should actually support their fellow women. Most times, I try to encourage every young lady that I see to please go and take a shot of the HPV vaccine. I try to use myself as an instance that even as a guy, I don't have a cervix. I mean, I should be worried about prostate, but I don't have a cervix, but I took the shot, okay? So, as a matter of fact, with respect to age, the vaccine can be taken, especially when the lady is younger, is more effective and more encouraged at a younger age, 9 to 14 years. That does not mean that someone at the age of 21, 30, 35 cannot still take the vaccine, okay? However, it still does not prevent ladies above 21 to go for the pap smear, the papillomavirus smear, okay? They should be going for this check.
This can be done, this can be done in any hospital, so you just walk up to the hospital?
Not really any hospital.
Okay.
And there are some designated hospitals, especially secondary and tertiary centers.
Okay.
Okay. And then we have Muwan Center along Abakaliki Road.
Yes, name, yeah.
Yeah, so they can actually go for the test. And basically, there is other tests they call the visualization under acetic acid, visual inspection, VIA, under acetic acid. So that one is also used by the time you instill the vinegar, it kind of shows white patches. Those ones are a symbol of that. There are some abnormal cells. Okay, so a young lady should actually run these things like every 3 years. Okay, and then peradventure the person keeps on running it and gets to about the age of 65. The lady or the woman can actually not bother anymore about going for these checks. Okay, but the earlier the better. So we keep on encouraging our young girls, our mothers, to ensure that our girls are safe. As a matter of fact, this vaccine has actually been in circulation for over 15 years. Okay, used over more than 100 countries, and there has been some myths that it can cause autism, paralysis, and all that. But these are just claims. A whole lot of things are out there in the social media. And I feel that we are not really doing enough, especially we that are in the health sector. We're not really doing enough. We need more doctors in the social media space to actually debunk all these kind of myths and also ensure that we clamp down all this misinformation that is spreading, because a lot of youths are actually idle. I don't know how people make out time to create misinformation misinformative contents. I don't know what the benefit from it, and most of them are not even based on science. They're not even backed up by science.
Yeah, good enough that we are having this conversation. Now, this part of avenues to create more awareness. So let's talk about the side effects.
Okay.
You mentioned the fact that you've taken this vaccine. I know in our previous episode you touched this briefly, and I also affirmed the fact that I took it, and when I did, I felt some numbness briefly, and then some heaviness on the arm within just that day, and then I felt good afterwards. So for people with different bodies react differently, of course. They might come and tell you, this is what I experienced. But what is a normal side effect? At what point should you panic? At what point should you see a doctor? And basically, what is it like? Is it something that is painful for some, from a medical standpoint? Now, I'm not talking about me because I didn't get to feel any obvious pain like that.
Yeah.
So, but what is it like? What kind of side effect that should make people want to, rush to seek help at the hospital after taking this shot?
Okay. To start with, the shot is given at the forearm here.
Yeah.
Okay, at the upper arm. Sorry, at the upper arm, and then you feel a sting, just a little sting of the pain. Afterwards, some people may not feel any other pain at all anymore, but some others can still develop a little malaise or feeling of tiredness or weakness. Some people can feel low-grade fever or headache. These are usually the most common side effects. Then sometimes, when they do happen, I will advise the person to take a lot of water and a lot of rest. And if maybe the fever is of concern, the person can take paracetamol to calm down the fever. Okay? But then within the space of 24 to 48 hours, these side effects must have been off the system. And the person will have a full recovery. Should in case the person now develop a persistent high fever of about 39.4 degrees centigrade or 103 degree Fahrenheit, the person can immediately report to the nearest primary health care center or to the hospital. And that's just it for further management.
Okay, so before we take a break again or even hear from other voices that I spoke with over the weekend in the street of Enugu State, I still also want to talk about, I want you to expand more on the myth you heard about the long-term effect. When we started this conversation, we talked about the fact that people have, there are claims that part of the reasons why they're pushing for this free vaccine. Ordinarily, why would it be free? So why can't they just, keep it? Why would they target this age bracket? Because these are young girls and they want to give it to them for particular, reasons, so to speak. So, but are there really long-term effects, really from a medical point of view? Are there cases where you've heard people say, oh, I took HPV vaccine when I was 14, and when I got to 30, I started noticing my system feeling a particular way? Have there been scenarios like this?
I have not seen any. Myself, I have not seen. I'm not a gynecologist. That is not my field of specialization. But I have not seen, and I have not heard. I have a friend of mine that is a professor of gynecology and obstetrics, and he is even in support of our girls to go and take this HPV vaccine shots. In fact, as a matter of fact, all those long-term effects are just claims, not backed up by science. And one of the reasons why I took the shot myself was I actually wanted to know, am I going to have any of these side effects?
What if your system wasn't wired?
So I had to go and take the shot. I wanted to even, that's why I keep telling people that, see, I've even taken it myself.
Okay. Good enough that this information has been put out there. And if you're still watching, this is Gyna Plus right on Afia television. And the focus has been on HPV vaccine. And just last week in April, last week we talked about, we started up the whole, just in line with the World Immunization Week, we brought up the conversation on HPV vaccine and why it's important to take it because, of the long-term effect. And cervical cancer being the second cancer, the leading cancer death in Nigeria is something that is it's scary if you ask me. And one way to prevent that is to take the HPV vaccine. And I still spoke to some other women, just like last week, and this week I still spoke to more women to access the level of knowledge, acceptance level, and how far we've come as a state as it concerns the knowledge level of HPV vaccine. Let's just take a look again and then see what they think.
I know about HPV vaccine. No woman, no a girl, no a lady that should know about it. Because HPV vaccine is very important in the life of any woman, any girl, any female, to prevent cancer. Cancer is invoked now. It's too much. Every woman to go and do to take the vaccine. As long as you're a girl child, a teenage, every woman should go and do it. Go for the test. If you don't have it, they'll give you the vaccine. It's very important in any woman's life to avoid cancer.
Well, it's very good. I advise every woman to undergo this screening. You understand? Just to ascertain your health system is very good for every child, every girl child, every woman in fact. I prevent, a lot of things like cancer, you understand? At least you see that most of us women claim to be healthy, but when you go to the screening, you understand, you find out that there are a lot of things that you don't know about your system that you need to know.
I don't really know much about it. And there was a time my daughter came back from school and she told me that they came to their school to create awareness. And then she said their head teacher told them that they should inform their parents that they will be coming back on a set date for them to take the vaccine. So they should inform their parents. And when she came home, she told me, I said, well, it's okay by the school. Though I don't know much about it. You can go ahead. And she came back and told me that they have taken it. Yes, they have.
Thank you so much. And of course, at this point, we'll take a short break just like we always do. And once we come back, Dr. Ikenna would react on these and we talk more. To stay tuned. We'll be right back. Welcome back. I mean, this is still Gyna Plus right on Afia television, and we are still talking about HPV vaccine. Part 1, we've done and dusted with that, and this is part 2, and we're still talking about side effects, what you should look at for, at what point should you go to the hospital, and the general safety of HPV vaccine. So if you just tune in, welcome. And I'm still on the show is Dr. Ikenna Emedike, who is a immunization champion on social media for IPA and PAN for Enugu State, and he's been doing quite a great job.
Thank you.
And you, I mean, listen to these women again, just like last week. These people talked about. Particular lady, you notice her, the ginger in her.
Yeah.
I mean, she was quite passionate about the fact that if you're a woman,
like
you're a young
that
girl, and you're not taking the HPV vaccine, you should try and go and do it.
That's
it prevents
what I'm talking
cancer.
about.
You see the fire in her. But that's what she said. She has done her pap
That's
smear.
the energy I'm actually looking at.
She's done the pap smear, and she encouraged every other woman, young girl, teenager to go for it. And the other lady was talking about the fact that, she, of course, I've heard about it, but
doesn't know what really...
what kind of cancer. She just kept on saying because it's cancer and all of that.
Okay.
And other responses. Just quick reaction on that, then we proceed.
Okay, fine. I'm so excited and happy about the active lady. That's the kind of energy that I desire for our women to actually develop. If most of our women kind of develop that kind of attitude, I'm sure that our girls, our teachers, our market women in the market, and even the leaders of the home, our men, will definitely align.
All right.
With respect to the second lady, I feel that the population of ladies that are in that space is quite enormous. They are quite more predominant in our society. A lot of ladies, first and foremost, do not even know what cervix is all about, let alone knowing what cervical cancer is. I've had an experience, personal experience, when I was carrying, I'm in the Department of Radiology. When I was carrying a lady, she was having a chronic bleed per vaginum through her private part. And she has been going to see the chemist, going to see the pharmacy. She has been taking drugs for a long time, not knowing what the issue is really, up until the time that the cancer reached like stage 3, stage 4, has spread, has metastasized, to other parts of her body before they presented. I felt like shedding tears. I don't know this lady from day one. I felt like shedding tears because she's completely ignorant of what she's up for. But what did I do? I said, okay, fine, madam, there's still hope. I mean, thank God for Cancer Health Fund, a program that is actually trying to alleviate the burden of treatment of cancer. People don't understand that treating cancer is actually very expensive. And apart from that, there are no promises that you can be able to achieve 100% treatment. But with prevention, you will not get to that phase where you start fighting like it's cheaper. You understand? Prevention is better than cure.
I mean, that story, he got to me, it got me really emotional because these are part of the things we talk about on this show. Once you notice that there's something going on with your body and you're not too sure about it, it's important to talk to an expert, not a patent medicine dealer, an expert, someone who is very vast in the field to give you advice and probably treat you to help you stay healthy. I mean, thank you for that. Sometimes I get really emotional when it concerns
No, seriously,
women health issues.
It is.
Now let's talk about the still on social media,
Okay.
and because I mean, it's in that capacity that you, I mean, coming to us because that is what you do. You've been a champion online, trying to reach out to people to debunk some myth and give out information. But how positive would you rate this whole effort? Would you say you've so far, gotten to a point where you feel like, oh, certain number of persons have been reached, and yes, there's that positive, information spreading on social media. How would you rate the entire process, and then compare it to the conventional approach of, reaching out to people? Would you say it's been really successful?
Okay, I would say it is not yet successful. In fact, we have a whole lot of work to do. The harvest is large, laborers are few. And permit me to quote our former president that sometimes I feel it is easier to control cows than to really control Nigerians. Why am I saying this? One of the major challenges I have even myself discovered is that even some of the health workers that are even involved in the program, they don't even have trust for the vaccination process. That's to show you how deep the challenge is. So how can we now be able to pass the message across to the general population when some of the participants that are in the health system don't even believe in that process? We have a whole lot of work to do, my dear.
Yeah, when we talk about numbers, reaching out to numbers like this, sometimes you want to ask, what are the relevant bodies doing? For instance, we have the Enugu State Primary Healthcare Development Agency. What we want to ask, do they have an online presence that speaks volume? Because this is a question I have asked the team directly, because I was at a gathering where One Health measles rubella vaccine was, the whole campaign thing lecture was given. And one of the questions I asked the agency was, how present are you on social media? Because if you check some of this misinformation, you're doing a great job at the grassroots level. Some persons are somewhere, they're trying to thwart your efforts. How much of this online presence have you utilized? So, but do you think, I mean, beyond you now being a champion, pushing it on your own, out of passion, so to speak, because that's not your primary role.
Thank you.
So while you're doing this, do you think some of these bodies, what do you think should be done in terms of making sure that there's this active online presence, trying to do the campaign online as well as they do offline?
Okay. I will respond by saying more persistence. Okay? We need to actually be proactive and persistent in the information that we actually dole out. Then partnership, we need to build partnership as well. Because the government needs to support some of us that have the passion. Some of the medical doctors or any other person that is actually out there to pass the right information should be encouraged to partner with the Primary Healthcare Development Agency, so that when the government leverage this set of people, as much as I know, I'm going to use my good friend, Aproko Doctor, as an instance. The government is working with him, and he's actually, doing a whole lot of social media campaign. People listen to him. So when likes of him are being encouraged, I believe that there will be a more coverage in terms of information spread. Thank you.
Thank you so much. I mean, Dr. Ikenna, you've heard it all. So while he's doing the campaign online, it's important that you avail yourself of these opportunities. I mean, HPV vaccine, just like he has been saying, it prevents cervical cancer. And these cancers are actually treatable if you take these vaccines. But how about when it becomes a problem? Do you think it's something that you can manage? Prevention is better than cure. He said that on the show. And these are not things that you should ignore ordinarily. Thank you so much, Dr. Ikenna Emedike. It's been a wonderful time having you on this show.
Thank you
for all that you do online and all that you still do at the hospital. Thank you.
So much.
And of course, it's been a wonderful time talking with Dr. Ikenna Emedike, who is the social media champion for immunization in Enugu State under the umbrella of IPA IPA and PAN, that is the International Pediatric Association and the Pediatric Association of Nigeria. He's doing such a great job. And today he came up here to tell us how far he's done this work and the challenges that are online and why it's important that you ignore these things and go to the facility and take the HPV vaccine so you save yourself the stress of coming down with cervical cancer. It's not your portion, but it's not the case in this one. You need to do the right thing.
Absolutely.
And then visit our social media YouTube channel, of course, Afia Lifestyle and Culture. We have the part 1 there already, and then you can also catch up with other episodes on health shows that we've been talking on this program. Thank you once again. See you some other time. My name is Doris Mayopshishe. Have a lovely evening.